Hello everyone, my name is HUANG Ruibin. I'm a radiologist from the First Athletic Hospital of Shantou University Medical College. Welcome to the medical imaging class. Cerebral vascular malformations, CVMS, of the brain are a heterogeneous group of disorders that affecting arteries, capillaries, veins, or various combinations of vessels. In this session, we will discuss the typical imaging features of common cerebral vascular malformations. At the end of this class, students are able to describe the typical imaging features of four major types of CVMS, including arteriovenous malformation, AVM, developmental venous anomaly, capillary telangiectasia, and cavernous malformation. With modern imaging, and especially with contrast-enhanced MR, CVMS are found in up to 8 to 10% of imaged patients. Most venous and capillary malformations are asymptomatic and found incidentally. CVMS are estimated to cause about 5% of all non-traumatic intracranial hemorrhages. Most neuropathology tests classify CVMS into four major types: AVM, venous angioma, capillary telangiectasia, and cavernous malformation. The presentation, natural history, and management approaches to CVMS depend on their type, location, size, and hemodynamic characteristics. Some CVMS, such as venous and capillary malformations, are almost always clinically silent and therefore usually identify an imaging or autopsy. Others, such as AVM and cavernous malformations, may hemorrhage unexpectedly. An arteriovenous malformation, AVM, consists of a needles of tightly packed dialectic tortuous arteries and veins without an intervening capillary network, with the resulting being arteriovenous shunting. It is the most common symptomatic vascular malformation of brain. The risk of hemorrhage is 2 to 3% per year, with each episode having a 30% risk of death. Most lesions present clinically between 20 and 40 years of age and involve peripheral branches of the anterior cerebral artery ACA or middle cerebral artery MCA. Aneurysms of the feeding arteries due to high flow are seen in less than 10% of all cases. On pre-contrast conventional MR scans, multiple deformed vessels, most with low signal intensity due to rapid flow, are seen. Contrast enhancement often provides improved visualization of the needles together with the enlarged draining veins. Between the large draining veins, there will be preserved normal brain parenchyma that is usually little mass effect or calcification. These images show a classic cerebral arteriovenous malformation. Note the needles with interneedle aneurysm and enlarged feeding arteries with a pedal aneurysm. Contrast-enhanced CT shows strong uniform enhancement, which shape configuration is typical. Flow voids with low signal intensity are demonstrated on T-weighted image, with enhancement post-contrast of both the lesion needles and a large draining vein in this frontal lobe lesion. The 3D TOF MRA demonstrates flow in both of these compartments together with enlargement of feeding branches from the ACA. Developmental venous anomaly is a congenital cerebral vascular malformation with mature venous elements. In this condition, a statite collection of peripheral veins lined in white matter converge to the dialectic central draining vein. Patients can be asymptomatic or present with headaches. Imaging features include umbrella-like collection of enlarged white matter veins, medusa head. Many linear or dog-like enhancing foci converge on single enlarged collector vein. Collector vein drains into dural sinus deep ependymal vein, usually solitary, variable size less than 2 to 3 centimeters. Hemorrhage may occur if mixed malformation or draining vein thrombosis. This is a typical developmental venous anomaly in the left cerebellum in a 55-year-old man. T1 enhancement image depicts classic developmental venous anomaly with umbrella-like medulla head of enlarged veins converging on a dilated transcortical galactic vein. A cerebral cavernous malformation CCM, previously known as a cavernous angioma, histologically consists of a honeycomb of vascular spaces supplied by fibrous strands without intervening normal brain substances. 75% are superior tentorial with 25% multiple. These are usually visualized incidentally, typically without symptoms. They are prone to spontaneous hemorrhage and, for symptomatic lesions in at-risk patients, are treated by surgical resection. CCM usually are found at pons, cerebellum, and spinal cord with maximum in diameter less than 1 cm. On CT images, they usually show normal findings, and half of them also normal on T1 and T280 images. About 50% of cases may show faint stipple foci of hyperintensity. Large lesions may show ill-defined flare hyperintensity. Cavernous malformation in a patient is illustrated, showing classic imaging appearances of this vascular malformation. On a T280 scan, a proton bowl appearance is seen, but diagnosis also required the presence of a complete low signal intensity hemosiderin rim. On a post-contrast scan, heterogeneous spotty focal enhancement is seen within a different cavernous malformation. Another case with multiple cavernous malformations, a few small focal low signal intensity lesions are seen on T280 image in the right temporal lobe. A capillary telangiectasia is histologically a cluster of enlarged dilated capillaries in normal brain. They are rare, clinically benign lesions, within most common site being the pons. These are usually visualized incidentally. MR imaging characteristics include a size less than 1 cm faint contrast enhancement, and in about half of cases faint hyperintensity on frame. Figure A shows typical finding of developmental venous anomaly in the right cerebellum, and Figure B demonstrates capillary telangiectasia in the pons. These two incidental vascular lesions are both seen based on post-contrast MR, often being undetected on pre-contrast scans. A classic capsular medulla composed of multiple small veins draining into single large vein is well seen in the first patient. In the cerebellum, as illustrated, drainage is usually into the sigmoid sinus. In the second patient, a small lesion with mild contrast enhancement is seen on thin section imaging in the pons. Cerebral vascular malformations (CVMs) of the brain are a heterogeneous group of disorders that represent morphogenic errors affecting arteries, capillaries, veins, or various combinations of vessels. In this session, we discuss typical imaging features of 4 major types of CVMs, including AVM, developmental venous anomaly, capillary telangiectasia, and cavernous malformation. That's all for this section. These are useful learning resources for you to reference. Thank you.